Hi, my name is Rebecca Lahey, and I'm going to be showing my IV start for my skills lab today for Professor Lewowski's class. So what I'm going to do first is once I get the order to start the IV, I am going to check the patient's labs to make sure that all of their labs are within normal limits. I am going to look for any allergies, and then I am going to go ahead and go to the workroom and gather all of my supplies. So when I get into the supply room, I need to make sure that I have a tourniquet, a needle, or my catheter, which I'm going to start, and to make sure it's the appropriate size for the IV fluids that I'm going to be starting. I need to make sure that I have my INT extension tubing, 3 milliliter syringe, a needle to draw up the fluids, some tape, Tegaderm, gloves, and some alcohol pads. So once I get my saline, which I need to assess my bottle and make sure that the integrity is intact, that the expiration date is valid, and that the fluids look the way that they're supposed to look. So next, I'm going to go ahead and I'm going to wash my hands, and I'm going to take my syringe, and I'm going to draw up the fluids I need. So I'm going to go ahead and I'm going to draw back some air, 3 milliliters of air. I'm going to go ahead and take this off. First, I need to clean my bottle. You would never recap your needles, by the way. So I've inspected the bottle. I drew up my air. I need to stabilize my bottle. And I drew up my 3 milliliters of saline. So next I'm going to take the saline and I'm going to take my INT tubing. I'm going to attach it and I'm going to flush the tubing. After I flush the tubing, I'm going to clamp it. So once I have all of my supplies together and everything is prepped and ready to go, I am going to then go to my patient's room. So I'm going to knock on the door.
Come on in.
Okay, thank you. How are you doing today? My name's Becky. I'm going to be a student nurse. I'm going to be starting an IV on you today. Can you verify your name and your date of birth?
Azamina Messick, 1987.
Okay, perfect. So once that we do have the right patient, next I am going to ask the patient if they have any allergies, just to verify that what they're telling me matches the doctor's orders. The patient does not have any allergies. So I'm going to go ahead and I'm going to wash my hands and I'm going to put on some gloves. They don't have to be sterile for this. Okay, I'm going to try to use the non-dominant hand. You need to make sure that the arm that you start an IV on has never had any fistulas, that they have not had a mastectomy, that if they're having surgery, it's not a surgical site, and once all of that is verified, you need to assess the arm, make sure that there's no pain, and that the patient is comfortable with the area that you're starting it on. So once I've chosen where I'm going to start my IV, I'm going to go ahead and I'm going to take my tourniquet, and I'm going to put my tourniquet about 4 to 6 inches above the insertion site. So putting on a tourniquet, you want to grab the tourniquet, pull it up tightly, form an X, and loop this part under, forming a quick release knot, and also that it is tight enough. So next I'm going to check for a radial pulse, and I'm going to palpate my vein. So once I've decided where I'm going to start my IV, grab another alcohol pad. I'm going to clean my area. I'm going to go ahead and tap this. So I have informed the patient that we are just starting fluids today, normal saline. So you want to make sure the bevel is always up. I want to pull the skin tight down and I want to insert the needle at 15 degrees. So then next I'm going to tell the patient that they're going to feel a prick, sharp prick. Once I start to see my flash, I am going to push the needle in a little bit further, and then I'm going to slowly advance the catheter while I'm pulling the needle out. After that, I'm going to release the tourniquet and apply pressure. I'm going to grab my saline. Attach it. Make sure this is unlocked. I'm going to aspirate, getting blood flow, and then I'm going to flush with 3 mL of saline. So now that I know that I have an IV that is working, I'm going to bring this up. Clamp this back.
Instruct him not to pull out the tube, and if he has any nausea, to
Grab my ticketer.
So I check on him. I would then document the drainage, the color, the
I'm going to label my
type of
ticketer
tube,
with my initials,
time,
the date, and the gauge.
what type of tube, the
I'm going to grab one more piece of tape to stabilize the IV. I'm going to make sure the patient's doing okay, that they're not having any pain. And then I am going to document,
pH.
oh, after I throw everything in sharps,
Now
then I'm
that
going to document how many
all
attempts
that
it took, where I inserted my IV. I started on the right forearm.
notice that the patient's got a little nausea,
So the site, the number of attempts, which was 1, the date, the client's response,
gloves,
and the size and the type of needle. And then I'm done.
Awesome.
Okay, for my second video, I'm going to do the NG tube insertion. So after I verify get the doctor's order and get all my supplies, I'm going to go ahead and I'm going to go to the patient's room. So I'm going to knock on the door. And, hey, how are you doing today? My name's Becky. I'm going to go ahead and verify the patient's name and birthday. So the patient verified their name and their birthday. I'm going to go ahead and check for any allergies. Do you have any allergies today? No? Okay, perfect. Well, then I'm going to explain my procedure to my patient. The doctor ordered an NG tube to be inserted because you were having a little bit of trouble swallowing and eating. So, do you have any questions about this procedure? No? Okay, perfect. I'm going to go ahead and raise my patient's bed up because I need it to be at working level. Bed is coming up. And then I'm also going to go ahead and raise my patient into a high Fowler's position, making sure that it is not contraindicated for any other problems the patient could have. I'm going to go ahead and take a towel and place it over the patient's chest just to try to keep everything clean. And I'm going to go ahead and remove my patient's pillow. Next, I'm going to wash my hands. And I'm going to put on some gloves. I'm going to get my tube. I have a 16 French Levine tube. Make sure everything is situated. I have all of my supplies. First, before I do anything, I'm going to check my patient's nose. I'm going to look up each nair and make sure that there is nothing blocking it. I'm going to occlude each nostril and ask the patient to blow, sniff. So sniff, okay, sniff, okay. Next I'm going to inspect the mouth to make sure it's not swollen, and it's not. So I'm going to grab my tube, and I'm going to go ahead and put some lubrication on it. Oh, before I put lubrication on it, I'm going to go ahead and use the next process. So I'm going to take from the end of the tube to the tip of the patient's nose to the ear, and from the ear to the xiphoid process. And then I'm going to grab a marker, and I'm going to mark that spot, and that's going to be my safe zone. Okay, so once I do that, Now I'm going to put lubrication on it. And I've decided that I'm going to use the left nostril because the stomach is in the left upper quadrant, and that helps me remember. So when I start putting the tube down, I'm going to take my light and I'm going to make sure that the tube is not coiling behind the throat. I'm going to give the patient a cup of water if they can help me and have them swallow and take some sips. They're going to start with their head back, and as I progress the tube down, they're going to then lean their head forward. So if the patient begins to cough, I am going to pull the tube out just a little bit, take a second, and then I'm going to keep administering it. Once I get the tube to the safe zone, I'm going to take a piece of tape, which I've already put 3 pieces of tape out, and I'm going to secure the tube to the patient's cheek. I am then going to check the mouth one more time. Check the mouth one more time to make sure nothing's coiled. Oh, and ask them to speak. Can you speak? Okay, perfect. And now I'm going to go ahead. I'm going to take a syringe and I'm going to draw up some contents from the stomach. I'm going to take just a little bit and I'm going to put it on a pH scale to make sure it's a pH of 2, so that's within normal limits. And then I'm going to inject the contents back into the stomach while I'm listening to make sure that I can hear air. And it's going to be in the upper left quadrant. Bloop is the noise you want to hear. So I know that that's in the right spot. And then I'm going to take this off and I'm going to hook this up to whatever feedings the patient needs to receive. The best way to check for proper placement of an NG tube is an X-ray. However, it just depends on which facility you're at. Oh, or I'm going to, but now I'm going to go ahead and get another nurse to come in and verify. So then I'm going to tape the tube. Make sure I can see it. Down and then over the nose. And then I'm going to take the third piece and I'm going to put it straight across for extra security. Okay. Can you pause it? Okay, so once I have taken the tube off and come back in, I am going to, 30 minutes later, I'm going to put this syringe on and I'm going to aspirate 30 mLs of gastric fluid, and I'm going to put it back in while I listen to still make sure that the tube is in the correct spot, which is the left upper quadrant. So I'm going to inject it back in and I'm going to hear the and if that's correct, I am then going to draw up some saline. Squirt it out if you draw it too much. And I'm going to flush my NG tube. And then I'm going to discard of the saline. For my next video, I'm going to be doing the IV administration. I'm going to get my doctor's orders, and today my doctor has ordered Rocephin for my patient because my patient has a UTI. A little bit about Rocephin is that it is a 3rd generation antibiotic. It can cause, you need to make sure that the patient does not have allergies to penicillin or milk products. It can cause seizures, Stevens-Johnson syndrome, or anaphylactic shock. Do you turn the computer? Doctor ordered Rocephin 1 gram IV daily as directed. We have available 500 milligrams, so I'm going to be giving 2 milliliters of Rocephin at 17 drops per minute. Okay, so once I get all my orders and I check my patient's chart and make sure that there's no allergies, I'm going to go ahead and get all my medications from the drug room. I'm going to get my Rocephin, make sure that my bottle is intact, check my expiration date, check the fluid, make sure everything looks good. I'm going to get some alcohol swabs, some syringes, and then I need sodium chloride. So I'm going to wash my hands before I start prepping all my medications, and I'm going to go ahead and clean the top of the medication bottle. I'm going to draw up some air. And I'm going to draw up 2 milliliters of Rocephin. Okay. So once I have that, I'm going to change my needle because I now need to inject it to mix my medication with my sodium chloride. So while I'm stabilizing this bag, I need to make sure that I do not puncture the bag, cause any holes. I want to go straight down, and then I'm going to inject my Rocephin into the sodium chloride. Pull my needle out, discard this into the sharps. I'm going to mix my medication. So now I'm going to get everything together, and I'm going to go ahead and go towards my patient's room. When I get in my patient's room, the first thing I'm going to do is verify my patient's identification, check their wristband, match their name and their birthday. I'm going to assess their allergies, and I need to make sure that if they have never been on Rocephin before, that I stay in the room for the first 15 minutes of the infusion time. So I'm going to go ahead and wash my hands, and I'm going to put on gloves. I'm going to assess the arm. I'm going to make sure that everything is intact, that the patient isn't having any pain, there's no redness, there's no bleeding. I'm going to go ahead and grab my line and I'm going to go ahead and hook this up to my sodium chloride. So I need to clean. You need to make sure that you wipe the top of this off, and then you just simply slide this into here. You need to make sure that this is closed all the way. So once this is closed, I can go ahead and hang this up. And I want to squeeze this a couple times, get it about half full. Now I'm going to open to make sure that this is running smoothly. Okay, it is perfect. So you don't want to keep it open because medication can be extremely expensive. So I'm going to go ahead and hang this up. So now I'm going to grab my saline. I'm going to wipe my port on the IV. I'm going to hook this up. I'm going to aspirate. And then I'm going to push 3 milliliters, half of a milliliter at a time. Push, stop, push, stop, push, stop. Once I reach 3 milliliters, I can go ahead and hook up my line. Open my clamp. And I need to watch this and make sure that it's getting 17 drops per minute. That way I can speed it up or slowing down if I'm not getting the appropriate calculations. So after 30 minutes, because it's only supposed to run over 30 minutes, I'm going to come back in the room, and once this is finished running, I'm going to go ahead and disconnect this, close this line, wash my hands, put on gloves again if I've left the room. Go ahead and disengage this. Okay, so I need to clean my port again. And I need to flush again with the last 3 milliliters of saline or heparin if it's the doctor's orders. So I'm going to do the same thing. I'm going to just push. I'm going to push, stop, half a milliliter at a time. So once all of this is finished and the patient has gotten their medication, reacted well to it, it was infused during the proper time, I can go ahead and clean up all my mess, put everything away, and document everything that I did. So you want to make sure that you get in the MAR the right time, right drug, right route, right dose, right volume, right patient. And I completely forgot to label my medication, which I would have done. So I would have put the right patient, the right drug, the amount, who added it, the date, and the start time, and had the expiration date on here. And I would have labeled the 2. Okay, stop it. Okay, so once I have all my supplies and I've mixed my medication, I'm going to go ahead and go to my patient's room. I'm going to go in there, I'm going to introduce myself. Hi, I'm Becky. The doctor ordered Rosefin, so I'm going to go ahead and piggyback that onto your IV. Check the patient's name and birth date, see if they can. Okay, so for my last video, I need to add a piggyback. So my patient's already got a IV fluids running in their room. So I check my doctor's orders, and they say that my doctor has decided that my patient needs to be on Rosefin. So same thing with Rosefin, it is an antibiotic used for UTIs, upper respiratory infections. I need to make sure that what I was ordered and what I have available, that I do my equation again. So I'm going to have 2 milliliters of Rosefin. And I need to distribute it again at 17 drops per minute. So I'm going to go back to the room, the med room. I'm going to get all of my stuff. So I'm going to get my sodium chloride. I'm going to get my Rosefin. Same thing, check my bottle, make sure it's not expired. Make sure the fluids look good. I'm going to get some syringes, some injectables. So I'm going to go ahead and wash my hands. And I'm going to clean the top of my bottle. And drop some air. And I need to draw up 2 milliliters of Rosefin. Okay, so I've got that. I'm going to go ahead and take that needle off, put it in sharps, put another needle on. I have my sodium chloride, so I need to wipe where I'm going to inject it. Make sure when I put this needle down that I am not going to compromise the bag. I'm going to inject that, and this is going to go in sharps. So I'm now going to mix my antibiotic with my saline. I'm going to get my secondary tubing and all my supplies, and I'm going to go to my patient's room. And I'm going to label my medication with the date, the drug, what patient I'm taking it to, the amount, who added it, the room number. So okay, so once I have all my supplies and I've mixed my medication, I'm going to go ahead and go to my patient's room. I'm gonna go in there, I'm gonna introduce myself. Hi, I'm Becky. The doctor ordered Rucephin, so I'm gonna go ahead and piggyback that onto your IV. Check the patient's name and birth date, see if they can verify it. Once the identification of the patient has been done, I'm gonna go ahead and wash my hands and put on some gloves. And then I'm going to assess the site again, make sure that the patient's not having any pain, that nothing's leaking or bleeding. So everything looks good. So I am now going to add my secondary tubing. Take this out, clean it. Push that in, make sure this is prime or closed for right now. Make sure it's closed. And then I'm going to go ahead and I'm going to take this. Can you move the computer over a little bit? So I'm going to take this one and I'm going to drop it. And I'm going to bring this one up here. I'm going to use an alcohol swab and I'm going to clean this right here. Make sure it's nice and tight. Oh, first I need to prime it. Good, but just a little bit. Add this. Okay. Go ahead. Oh, squeeze this. And open it and make sure that I'm watching it to where I'm getting 17 drops per minute. Because if I'm not getting that, I have to adjust it. Okay, so then I need to, after I've established my flow rate, I need to make sure that there's no complications with the infusion. And this will infuse over 30 minutes. So once this is finished, I will come back in the room, make sure that everything went in, the IV is still intact. I'm going to go ahead and close this off, disconnect this, and then I can bring this one back up here. Get rid of everything, dispose of what I'm done with. Check on the patient, make sure that this is infusing good again, make sure everything's open. And then I need to go chart everything into the MAR and make sure that I have the right patient, the right dose, the right site, that there was no complications, and then I'm done.